Public health is what keeps our community functioning. The mission of public health is to utilize resources to improve people's overall quality of life and life expectancy. They do this through community outreach and early prevention services. They provide the community with the necessary resources to deal with the community issues on state and local levels. Public health does not function as one entity but is made up of many entities all fighting a common goal. This presentation will show you the core functions of public health, who is involved, who funds these services, legal and ethical issues, and the importance of communication. Public health's goal is to make necessary influences to the community's health by improving the overall quality of life and increase life expectancy. The core roles of community and public health are assessment, policy development, and assurance. This involves being knowledgeable of what is going on in the community, analyzing information, and making this available to the public. From this, policies are developed in the best interest of community's health and making resources available to the public to achieve the desired outcomes. According to Winslow, public health is the science and art of preventing disease, prolonging life, and promoting health and efficiency through organized community effort for the sanitation of the environment, the control of communicable infections, the education of the in-personal hygiene, the organization of medical and nursing services for the early diagnosis and preventive treatment of disease, and for the development of social machinery to ensure everyone a standard of living adequate for the maintenance of health. So organizing this benefits as to enable every citizen to realize his or her birthright of health and longevity. To achieve this, a multitude of organizations are involved with assisting public health achieve this mission. The United States Department of Health and Human Services, Center for Disease Control and Prevention, the National Institute of Health, the United States Environmental Protection Agency, the Institute of Medicine, and the World Health Organization, not to mention a multitude of other entities. Public health is crucial for minimizing human suffering from the effects of adverse health outcomes, but sometimes this can create legal and ethical dilemmas. While trying to achieve a social justice, the core foundation of public health can be challenged. One example is sometimes public health imposes expectations upon the community, but not everyone agrees with this, and it can cause some people to feel like their rights are being taken away. This can include the recent changes with healthcare, humanizations, and expectations on lifestyle choices. Also, ethical and legal issues can arise when public health tries to treat people, such as the case with pain management. One source of this legal risk is an apparent conflict between two public health goals, the reduction of addiction and the treatment of pain. Public health constantly encounters a gray area when trying to do what is best for the community health. Funding is what drives public health achieving their goals. Funding comes from a multitude of sources. Some of the most notable are the Centers for Disease and Control and Prevention, the California Endowment, the Social Security Act of 1935, the National Mental Health Act, and Partnership in Health Act. This funding helps aid in activities that are beyond the abilities of healthcare providers. The Centers Disease Control and Prevention funded the development of health communities. The California Endowment funded a $1 million program called the Building Healthy Communities. The Social Security Act of 1935 was funding for grants to states for public health services. The National Mental Health Act financed mental health research and mental health public health services. And lastly, the Partnership in Health Act funded block grants for various health programs at state and county levels. Communication is essential to the overall goal of community and public health. It is a two-way street where communication needs to occur between the community and public health. Public health needs to communicate and educate the public and let them know of the resources available to them. Public health needs to utilize clear, comprehensive, appropriate, and legitimized evaluation tools to assess the community impacts of public health participation in community action. In return, the community needs to be receptive of this information and let public health know what the community needs are and what health issues are at the core of community's problems.